Hello, listeners, and welcome to Beyond the Mirror. This isn't just another podcast, it's a deep dive into the world of beauty, wellness, and longevity. Now, we're here to discuss what beauty really means beyond just appearances. We'll also talk about wellness, the habits and practices that keep us healthy, full of energy, and we'll explore the topic of longevity, looking at the science and realities of living a long, fulfilling life. So sit back, relax, and join us as we go beyond the mirror.
Welcome back to Beyond the Mirror. I am here today to talk about intravenous fluids and how they can be a support for our immunity, brain health, performance, mood, and several other amazing benefits that are included with it. And so I'm here today with Tabitha Braun. Hi, Tabitha.
Hi, how are you guys?
She is actually a nurse practitioner here at Elemental.
Just now.
Fresh.
Fresh as of Friday.
You've been a nurse though for decades.
Yeah, I can say that.
Yeah.
It's been since 2007.
I love it.
So,
Awesome.
yeah, long
That's
time.
wonderful. Congratulations on your new accomplishment. That's so exciting.
It is so nice to have my life back.
I know, right? I gotta love
3
it.
years of school
Gotta
and
love
then,
it.
working full time
Yeah.
and school and boards, and now everything is working out the way it's supposed to.
Yeah.
I
It's quite an
think.
accomplishment though. That's really awesome that you did it.
Yeah.
Not everybody finishes, so it's amazing.
I did, and it's
Really
still very new to me. I
fresh.
think it'll sit in more when I'm actually practicing, working on the credentialing process. Right now, it takes a
Yeah,
little bit of time. So
it does. And I love where you're headed. You're going to be helping with hormone health and
yeah,
other options as far
um,
as women's hormones and
yeah,
making
yeah.
that nice blend.
I really enjoy. I mean, I've been an ER nurse my entire life, but I'm really interested in getting out of the hospital setting, out of the acute care setting, and focusing on preventative medicine, aesthetics, but then also just that women's health piece a little bit more.
Speaking of your career, you've seen a lot of sick people.
We've been seeing a lot of viruses around right now. Typical flu season is from October to April, they say.
Hmm.
And we are in the midst of it right now. It kind of ebbs and flows, but we've been very busy in the emergency department,
Yeah.
and a lot of stuff going around that just wreaks havoc on our everyday lives. And even some people with complex medical conditions can end up very sick from some of those common viruses around. So,
Yeah.
yeah.
And here at Elemental, there's a few things that we can help you with that maybe would be a good preventative measure from coming to see you at the ER, right?
Yes.
And that's our IV fluids. And so we have a lot of amazing IV fluids that we can infuse for you if you're starting to feel like you might be getting a little bit of something, or you're maybe full blown into it.
Or you're just
And
feeling run down.
yeah, yeah,
Um, Yeah, which is an amazing thing. So, we do offer a bunch of just regular IV drips. We have intramuscular
injections,
injections of different substances, vitamins, minerals, amino acids, and then the IV,
glutathione,
yeah, the IV
B12.
fluids,
Hmm.
B12, zinc, vitamin C.
All the good things that help you recover your immune dip a little
Yes,
easier, right?
yes. I've
And
I've certainly started my own IV in here before, so
yeah, yeah,
yeah.
she's a stud. I can't. She just did
Uh,
one for me today, so I'm very appreciative.
yeah.
I probably would have got it, but it'd have been a little bit of a struggle trying to connect the wide
I
tubing.
I do think I had one non-medical person come in. I'm like, "Just hold this, so when I'm ready for it, I can just hook it up."
Oh yeah, yeah, that's
So,
smart.
yeah.
Awesome.
So
Yeah, so tell me a little bit about maybe one of the immune boosting IVs that we offer here.
So, one of my favorites that we do offer is called the Recovery and Performance, and it is a blend of three other blends that we have. We get all of our vitamins, minerals, everything through the
Olympia?
Olympia Pharmacy and Pharmaceuticals, and they're pretty well known. But the one that I personally really love is the Recovery and Performance. And I have my little book here because sometimes I have to. I want to make sure I'm saying the right information. But this one is just great overall, and I feel like it really covers a lot. Um, it has the ascorbic acid, which is vitamin C. That's just the fancy word for vitamin C. It's got the Olympia Vita Complex, the amino blend, and the mineral blend. And so it really works on like a few different areas. So, like aminos, for instance, amino blend. Amino acids are building blocks of protein. All cells in your body require protein to replicate and divide and fulfill their functions.
Who would be a good candidate for the recovery and performance?
So, I would say if you are experiencing any type of immune deficiency in the sense of like just your overall immune system, maybe it's been under attack from chemotherapy or just stress, or maybe you were sick with a virus or a gastro type of, nausea, vomiting, diarrhea, even just the flu virus or COVID, for instance, anything that would have caused stress on your immune system and the keeping you healthy um, would be a great adjunct, I guess, to your recovery and your therapy.
Yes.
Also, athletes that sweat a lot, they get rid of a lot of different electrolytes. And so that would also be a good one. Hangovers. I I love this so much, and not necessarily just for the hangover aspect, but we actually had a group of women come in that were going to be heading to Mexico,
Yeah,
and they had an IV party, and it was so much fun. They were like prehydrating before they dehydrate, and
that's
so
awesome.
it was a lot of fun. And some other things, cold and flu symptoms, fatigue, brain fog,
Yeah.
those types of.
So tell me, we have a patient that comes in and she's had her own battle with cancer, and she comes in usually for an NAD
That
and
is
noticed
correct.
that her numbers have been the best that they've ever been. And what had she changed?
We actually decided not to do NAD the last time she came in. I actually decided to do the recovery and performance on her with the IV booster of glutathione. And so, for people who don't know, glutathione is an antioxidant. It is fantastic at working on helping for liver health. And you have to remember that whenever we take medications, especially when they go in through your mouth, they go through your whole
Digestive
digestive
tract.
system and
Yeah.
everything, and they get metabolized by the liver. So, depending on how many medications or alcohol or any other substances that we put in our body, our liver is working to break those substances down. And so you can only imagine that maybe our liver might need a little extra help. And so glutathione is really a great supplement that we can incorporate. And the best part, I think, too, is that it goes in through the IV. So it bypasses what we call like a first pass metabolism, or it bypasses that GI tract. So there's actually more of it available to the body and to the liver to use, which
Yeah.
is another key thing.
And
But
every cell uses glutathione too, so it's
right.
very important, and that's how you detox as well.
But what was great is that she had come in, I guess, like a month ago, and she came back today and she told me my cancer antigen is the lowest it's ever been. She has been recovering from ovarian cancer, and
Yeah,
it
it's
has
amazing.
dropped to 12. She's like, "I've gotten it down to 14, but never 12." And so she's actually
Yay.
switched from the NAD and she started doing this combination that seems to be working. So that's a pretty cool thing.
We also have people come in to do this pre-surgery and post-surgery as well, and it's a great way to recover more quickly as well. So that's something that's on your agenda. It's a great tool to have.
I will say just to tag on to this. So the amino blend that I wanted just to highlight. So when we were talking about athletes, a lot of pre-workouts have L-arginine or I think arginine and lysine are the ones that I'm most, and carnitine. So this amino blend does have the glutamine, the I can't say that one, but the arginine,
Or
lysine,
theanine,
and then the carnitine, and you could say that last one maybe.
citrulline.
But a lot of those are in the pre-workout, so it's a lot of the same stuff to
It goes
help build
straight in.
muscle.
Yeah, so that's awesome. So tell me a little bit about the Myers cocktail because that is a very popular one as well.
So I will say probably what really turned me on to IV therapy, besides the fact that I'm a nurse, but just adding things. I actually tried a Myers cocktail for the very first time when I was very sick with a bad tonsillitis that had turned into the beginnings of a peritonsillar abscess, and it totally wrecked my immune system. And so the Myers cocktail is a really good, just basic, you want to support your immune system without anything fancy, but you're going to get results. This is one that would be really good, and that's so it's also a great preventative therapy for cold and flu, reduction of fatigue, hangovers. Again,
Can't go wrong with any of them,
it is
really.
the Myers cocktail is considered the gold standard.
Yeah,
So
I love that.
um, but yeah, and I'm telling you what, I did feel a lot better, and it did help me recover a lot quicker.
That's
So,
awesome. So if you're somebody who wants maybe that ageless look, you're looking for more of a for a beauty standpoint, what are some things that you're gonna maybe want to use in an IV?
oh, no Botox today? Okay.
You could do that too.
No Botox on this talk, but so biotin. Biotin is basically what all of our skin, our hair, our nails, um, is
Growth,
all
cell growth.
biotin,
Yeah.
basically. And so you can even get that in IV form as well. And it helps even give you more of a healthy sweat gland if you
That's awesome.
care to even care. I mean, I don't even really
Care to
know.
sweat less?
Yeah, exactly. Or have healthier sweat, maybe. I
Healthier
don't
sweat,
know.
cleaner, healthier
Yeah.
sweat. I like it.
So stronger hair, nails, prevention of hair loss.
It also even helps for weight loss too, so it's a nice little side effect.
That is non-pharmacological.
Yeah.
So
Yeah. Very cool. Awesome. And so tell me a little bit about like maybe they want to customize their own like they want to start with a recovery and performance, but yet they're like, I kind of think that I want to add in this, this, and this. Is that something that you can do?
absolutely. So the best thing, and just from a nursing perspective, is all of this stuff is compatible.
That's a
So we
nice
don't
thing.
have to really worry about, well, what's in the IV fluid that might.
Might not interact. Yeah.
Right,
Yeah.
exactly. I mean, there are a few things that we need to know, but so that's a really great thing. And so actually on our upgrade menu, we call it, we do have here at Elemental, you are able to then add IV boosters. So some of the IV boosters that may not come in our IV that we have decided to do for you, are, things you can add on: extra vitamin C, B12, which is, great for energy. We have the Triimmune, which is vitamin C, glutathione, and zinc. We also have a B complex. And so what's really great about those is they're like an IV push. And so they're not going to make you feel bad. We can do as many of those as you want or your budget allows, and they all go straight in. And all of our supplements, vitamins, everything is water soluble. So, whatever we put in, if your body doesn't use it all, you pee it out. And so it kind of tops off your tank a little bit there.
Love it.
So that's really nice.
So is there anybody who wouldn't want to get a IV?
I mean, I don't know anyone who wouldn't, but
Me either. I
there
didn't
are
know.
people we should caution,
Correct.
I would
This
say,
is correct.
only because of pre-existing medical conditions. So, just as if you were to go to the hospital and, thinking you're dehydrated, but maybe you have congestive heart failure, maybe you have some uncontrolled hypertension or high blood pressure, anything that's going to interact, or like lymphedema,
Yeah.
um,
Or kidney failure.
or some kidney function,
Yeah.
we have to be careful of how much fluid someone is getting, because the amount of fluid that goes in, that increases your circulating blood volume. And so if your key organs are put under stress already, such as the heart or kidneys, we have to be cautious in the amount of fluid volume that we would be doing. And so typically the patients that we see here are very healthy. And I'm not necessarily talking about cancer. I mean, cancer is one of those diagnoses, but we really have to look at each patient individually to see if this would be an option for them,
Yeah.
because it can get a little complicated, and
Yeah.
we sure don't want to do anything that's going to be
Cause harm.
detrimental.
Yeah.
So,
Absolutely.
I
Our
would
first oath
yeah.
as nurses, right? Do no harm.
Oh,
Yeah.
yes.
Awesome.
Yeah, so those would be some things that we would want to take into consideration.
Wonderful. Thank you for answering that.
Yeah.
How about the brainstorm? So for someone who's looking for maybe a little bit better cognitive function, being a little bit more mentally clear, tell us a little bit about the brainstorm.
So brainstorm has what's called alpha lipoic acid, which
Is brain protective, neuroprotective?
yeah, it
Yeah.
kind of helps with I'm trying to think of the best way to describe this, like how it works. It kind of works on those neurons and the myelin sheaths, and
Yeah.
protecting those nerves.
Neuroprotective. Yeah.
We also have the vitamin B12, the L-taurine, which is an amino acid, and then the folic acid. And, folic acid. So here's, if you think about it, folic acid, women of childbearing age, folic acid is huge, especially in our prenatal vitamins. They
Yeah.
all have folic acid. And the reason for that is early on in pregnancy, by the age of 6 weeks, I think. I could be wrong, so don't get me if I am, but I'm pretty sure it's 6 weeks. It's usually before most women even know they're pregnant, and this is why they always tell them to be on prenatal vitamins. Is that's when our neural tube defects, the neural tubes close basically, and that's when we'll be at most risk for neural tube defects like spina bifida, anencephaly, some of the more like spinal, you think brain and
Neurological.
spinal
Yeah.
cord. And
Gotcha.
so that folic acid is huge and very important for that development in a fetus. We, so it only makes sense that as adults, or even just people in general, that folic acid would be great for brain support. And so
Absolutely.
that is also in this particular IV cocktail.
And it's metabolically enhancing too. So get a little bonus
Ooh.
there too, right?
Yes.
And then we have one called Reboot. That one's good for like hangover, nausea, dehydration as well. So we really have such a plethora of ways to help you no matter what it is that you're dealing with. And, if you're not somewhere in St. Louis where we could help you, there are IV hydration places all over. I have a good friend that's in North Dakota, and we hunted down a place. She's in the middle of nowhere, North Dakota. And we had to hunt down a place for her to go to. But she's like, oh my gosh, I feel so much better. And she had been struggling with a lot of respiratory issues, a lot of sinus infection type stuff, and it took her down,
Yeah.
and so I was like, I know one way that helps me tremendously. I start to feel a little bit of anything and I get the Triimmune,
Yes.
and we're all kind of
Yes.
like that here where we're like, okay, like I'm starting to feel a little,
Little
whatever.
down,
or,
little
or yeah, tired or fatigued or run
not feeling
down.
our best. Let's just put
Yeah.
that way. It's gotten me through this flu, COVID,
Huge, huge.
studying, stress cycle that I've even been through over the last few months, or years, but
Yeah.
months.
Love it.
So, I definitely will take my Triimmune, and
Yeah.
I do think that really helps a
Oh,
lot.
yeah, and so we're such advocates for, boosting your immune system however you can. I mean, I know during the pandemic, they were using a heck of a lot of vitamin C and zinc during the time, and
Vitamin
so
D.
yeah, and D3, and so it's just a great way to give yourself that little boost that you need, to get you over the hump and get you on to feeling much better.
Yes.
So we thank you so much for listening,
Yeah.
and we hope to see you on another episode of Beyond the Mirror.
Bye.
We want to make a quick but important disclosure. The information and advice shared in this podcast are intended to provide general knowledge and understanding about wellness and health related subjects. They are not intended to replace professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or qualified health provider with any questions that you may have regarding a medical condition or treatment, and before undertaking a new health regimen. Remember, your health is your responsibility, and it's always best to consult with a healthcare professional.